Good morning, Miss Gabby and friends. So today I'm going to present about COVID-19. So what is COVID-19? COVID-19 is coronavirus disease 2019, or capitally abbreviation as COVID-19, is infection disease caused by SARS-CoV-2 and type of coronavirus. People with COVID-19 may experience fever, dry cold, and difficult breathing. This need also medical attention requirement because most people who fall sick with this COVID-19 will experience like moderate symptoms and recover without special treatment, and however it will become serious ill. And the symptoms, it will become fever, chills, and cold, also headache, and it also become breathing difficulties. So, and next one is how coronavirus attack the body. So virus enters the body first, and the immune system will usually immediately activate to innate immune response to carry out the normal resistance to the virus until system can activate the response system. This one is the human body has immune system that always monitor that check if there are a strange cell or germ that is entered the disease. When the immune system cell finds like a cell or microorganism that's considered dangerous, it'll be wrecked immediately. Like was like when the attacker uh, such as the coronavirus enter the body, the immune system will usually immediately activate it and innate to immune responses to carry out the normal resistance to the virus until the system is mobilizing and stronger adaptive immune system against the virus. This second line of defense can provide amazing resistance that involves making killer cell, namely T cell. A virus that infect your body by entering healthy cells, they are the infector make copies itself and multiples throughout your body. Because the coronavirus have the spiky protein surface, the receptor on healthy cell, especially those in your lungs. Now, that's how the COVID-19 get in your respiratory system. So COVID-19, while in the most viral particles travel only the short distance in some way to stay airborne for hours. And the second one, the infected occurs that the passage to lose the smell of taste and can be in early indicator. And in search of the AC2, ACE2 receptors, the fire particle can be travel to the deepest part from the lungs and the alveoli. In alveolus, they're responsible for the exchange for like gas, oxygen, and carbon dioxide in the blood. The alveoli are ground zero for the virus attack on other side. And the next one is the inside of type 2, the alveolar cell, in a like a key of lock, because the coronavirus have the spike protein, right? So like a key and lock, the coronavirus use the unique kick and crown the shaped spike protein to the invade the cell and replicate it. The cell alert the immune system to call for help, but experts believe that the virus may suppress that the distress the signal. The virus eject the host cell and force it to create the copies and the biological code. Particles are assembled into the more virus and released back into the alveolus cavity, and host the cell are destroyed. The structure of this cell, the spike protein, because the key, the spike protein, the spike protein is critical for binding of the host cell that receptors for to facilitate the enter of the cell. And the lipid member, it's the available virus acquire lipid members as the outer coat through the interconnector with the cellular member during the morphogenesis. And the infected cells, it contracts like a non-inflammatory virus that typically like exit cells by cell lysis, and lipid members are not part of the relation viruses. And the last one is an RNA. The RNA virus is virus which has a ribonucleic acid. It's genetic material. The nucleic acid is usually like single standard RNA, but it may be double. It might be double stranded. The responses of the cell, the fluid build up in the lung as the body defend itself, resulting the shortness of the breath and pneumonia. The virus continue to attack more cells. And the inside of the alveoli cavity, the immune cell knows that the macrophage release the cytosis and the protein that uh, investigate the blood vessel and recruit the virus fighting cell. The virus aggregated the host cell, forced into the copies and the biological code. And after that, the inside of the alveolus cavity, the wicked blood vessel leak the plasma into the internal space, the cavity that feels like fluid debris and further stretching the alveoli. Now, the inside of the alveoli is fun. The as the alveoli cavities with the fluid and the debris in the action of the oxygen CO2 become impaired. In some of the cases, its immune system overread. It says the inflammation can be contributed to multiple organ failure and septic shock. Yeah. And also, what about the system damage? The system damage, the fire doesn't just don't not just attack the lungs, but also can attack from the other organ, like including heart, brain, kidney, or it can be liver, can also be affected. COVID-19 may also cause the long-term damage in and also can lead to death. So there's a neutralic damage manifested as the confusion, the bleeding, the seizures have the also have repeated. Lung damage can be leave the permanent scarring, and the blood clot can cause the serious stroke, pulmonary embolism, and heart attack, and can be restrict the blood flow to the limbs. What about the treatment? So referring the patient with serve the substance for treatment and the required of referral hospital. It's for those who get a critical, like the patient get critical illness. It will be like a care include oxygen for ill patient, those who are at risk for severe disease or more respot uh, respiratory disease and more validation for patient who are critical ill. Encourage, and the second one is encourage patient to the self insulate and get to educated rest. Most people who sick, who get a COVID-19 or sick, will only have a mild illness and get better at home, because people who have might be feels better at home. It's about a week. People should manage their home system at home. On average, it's like take 5 until 6 days from when someone is infected with the virus for symptoms to show. However, it also can take up for 14 days. And then the third one is advise the patient to drink a lot of water to maintain body fluid level. In fact, there is no evidence that the drinking a lot of water is uh, water flushes out the new coronavirus. However, for good health in general, it is recommended that people should uh, drink water every day for good health to prevent the dehydration. While staying dehydrated by drinking water, it's important for overhead. It's not just a prevent for coronavirus infection. And the next one is how's the vaccine work? So the COVID-19 uh, vaccine will help our body develop immunity to the virus, because COVID-19 vaccine is not to cure us, but it's to make our body immunity become like stronger or make more secure. Vaccine is function not incurring the formation specific immunity, because the body immunity to able to fight COVID-19. If typically take a few days to vaccinate to produce the type T like proteases and B like proteases. Therefore, it's possible that the person could be infected with the virus that caused COVID-19 just before or just after vaccination that get sick because the vaccine did not enough to provide the protection. The body of the person who has injected with the vaccine will stimulate the antibodies to learn to recognize the wicked virus, and thus the body will expose to the virus and reduce the risk of exposures. In general, getting the vaccination, even if you have a COVID-19, means you have more likely to be protected for longer. COVID-19 vaccine are very effective to preventing the serious illness like hospitalization, or even can be death from all current of virus variation. And that's all for me. Thank you for listening my presentation.